The EU elections are here. What does that have to do with vaccines? Everything. This is a story of death and betrayal, of how the European Commission prioritized Big Pharma's profits during the COVID-19 pandemic over the access to life-saving vaccines for the world's poorest. In the early months of the pandemic, Commission President von der Leyen repeatedly stated that vaccines against COVID-19 should be treated as a universal public good, accessible to everyone who needs them. This was also stated in the agreement between EU member states and the Commission. But these promises were betrayed. The EU quickly abandoned the global public good approach and instead treated the vaccines as private monopolies owned by a handful of pharmaceutical corporations, which was what the pharma industry lobbying demanded. The EU's international vaccine strategy became fully focused on voluntary donations of vaccines to countries in need, a strategy that failed miserably. The EU also sided with and advocated for big pharma demands in the global negotiations about a TRIPS waiver, which could have led to the temporary global easing of intellectual property rights on COVID-19 vaccines and treatments. So, what happened? Big Pharma notoriously does not hold back when it comes to lobbying expenses, and this was no exception. And it proved to be a good investment. During a time of massive windfall pandemic profits, Pfizer, which has been accused of pandemic profiteering, made extraordinary revenues. But it was not only its superior lobbying budgets that handed Big Pharma such lobbying victories. The European Commission displayed a clear bias in who it met with to discuss the global scarcity of COVID vaccines and medicines. In addition to extreme patterns of unequal access to decision-makers, the European Commission insisted on an unprecedented level of opacity to avoid accountability over its vaccine strategy. And no less problematic is the European Commission's continued refusal to disclose text messages exchanged between von der Leyen and Pfizer CEO as part of EU vaccine contract negotiations. Such secrecy violates EU transparency law and undermines public trust, failing to force the pharmaceutical industry to allow generics production, and leaving key decisions about how much to produce and who to sell it to in the hands of the industry, resulted in a disastrous vaccine scarcity that prevented the world's poorest people from getting vaccinated.
A catastrophic moral failure.
A new approach is needed to ensure that public investment into medicines research actually serves the public interest. We need to move towards a public pharmaceutical infrastructure that is driven by public health needs.